If you're new here, hello, hi, welcome. We're doing an ADPIE series. In this episode, we're doing part 3, the planning. Now, planning is where students will either lose their care plan points or earn them. So let's make sure we know how to properly using the SMART technique. Now, what is planning actually? Planning in the nursing diagnosis world means 2 things. 1, you're setting a patient-centered goal. What do you want to happen to this patient? What is the outcome you're working towards? And 2 is choosing the nursing interventions that are actually going to get you there. What actions will you take as their nurse to get the outcome that you're saying you want for them? Here is the key thing I want you to hear. Your nursing diagnosis moves and flows into your plan. And your plan flows directly from your nursing diagnosis. If your diagnosis is about impaired gas exchange, then your plan is about gas exchange. Everything has to connect to actual improvement of gas exchange. Now, I mentioned something about the SMART technique. Let's talk about what that is. The goal that you write in your care plan has to be specific, measurable, achievable, accurate, and timely. So let me show you a difference between a weak goal and a SMART one. A weak goal will be a patient will breathe better. That tells me absolutely nothing. It tells you absolutely nothing. And there's no way for us to make sure that that's actually the outcome that's happening. Now, a strong goal would be the patient will maintain an O2 sat of at or above 95% by the end of the shift or for the entirety of the shift. It's specific because you're using O2 sat. It's measurable because you're saying it will be at or above 95%, and then it's achievable because 95% is actually achievable for someone. It's relevant because it connects to the fact that they have impaired gas exchange, and it's timely because you've indicated for the entirety of the shift or by the end of the shift, which means there is an end goal or a place where you can determine whether the outcome has come true or not. You see how that's very different? Specific goal tells you exactly what you're working towards, and it tells you exactly how you'll know if those interventions have worked. Okay, so we've had our goal. The goal is SMART. We love that. Now let's talk about interventions. What are you actually going to do to help achieve that outcome? There are 3 types of nursing interventions. There are independent interventions. These are the things that you initiate as a nurse without a physician's order. And this is like teaching, positioning a patient, repositioning to prevent pressure injury, encouraging deep breathing, ambulating the patient, or emotional support. The second thing are dependent interventions. And this is what requires a physician or provider's order. And that would be like providing oxygen, medications, ordering labs, or any specific procedures. You can carry out the order, but the order has to exist first. And the last type of intervention is collaborative interventions. This is an intervention that happens with other members of the healthcare team, like physical therapy or respiratory therapy or a dietitian or nutrition coming in. Your care plan should and can include all of these interventions or just 2 or just 1, depending on what your ideal outcome is. And it absolutely should be directly related to helping you get the outcome that you want, because otherwise, why is it in the plan? Now, the last part is understanding and writing that rationale, because they want to know why you're doing this. What supports this intervention? And this is where you're going to show your clinical thinking. For example, if you're going to reposition the patient for impaired gas exchange, you can indicate that repositioning at 30 to 45 degree helps with lung expansion, and that improves gas exchange. That is a rationale. That explains the intervention and why it's related to impaired gas exchange. Rationale doesn't have to be long, it just has to be accurate and relevant. That is part 3 of the ADPIE series. I hope this has been useful to you thus far. Now, planning is about SMART goals, it's about relevant outcomes, and it's about understanding and explaining your rationale. Part 4 is implementation, and this is the actual hands-on of the nursing care plan. And this has a thinking that isn't always explicit in nursing school, so if you're interested, stay tuned, subscribe so you don't miss. Comment below any questions that you may have, and I'll see you in the next one.